Hello, we are very pleased to welcome you at the ICS 2024 in Madrid, Spain. And we will have some discussion with two good friends and two attendees of the meeting today. Salvador Alandis, the local guy from Spain, and Michel Windel from Belgium. So, dear colleagues, we can start with Michel.
Okay.
What is your main message of today's meeting? Which session did you attend and what did you see?
So I went to a very nice session this morning which highlighted that we are entering a digital revolution in continence care. There was a lot about mobile apps, distant patient monitoring, telemonitoring. And among those, one of the absolute highlights was an abstract which described a study on machine learning of patient-reported symptoms. And it showed how, purely from the symptoms, you can get to a diagnosis, but also how some frequently undiscussed symptoms come out of the patients. Like fecal incontinence, they rarely talk about it, but through this machine learning, it came up much more frequently. So it can really help us in our care for patients. So I like that.
Did you see any paper or report about artificial intelligence in our field?
Yes.
Yes.
Well, the machine learning
yes.
was very nice.
And we know that regarding national database, and we will get a lot of information
from that.
And I am absolutely convinced it's part of the future for our field.
I think so, yes.
Yes. And Salvador, what did you see today?
Well, I was in a very interesting roundtable. I participated in that roundtable about the new surgical therapies in male LUTS problems due to benign prostatic enlargement. And for sure we know that TURP is the gold standard, but there are many rising new minimal invasive therapies. We talk about that, discuss about the advantages, disadvantages, and why patients need to be taken into account in the shared decision making just to undergo surgery or not, especially sexual factors, comorbidities, and the fear for complications that many patients can have. So we need to discuss. So it was a very interesting discussion about that. Even we talk about what means if we need to prolong so much time the pharmacological treatment, or maybe these new treatments could be in advance, treat much earlier, just to prevent theoretical deterioration of the tussle muscle. Well, this is a point, very exciting point, and we need more insight, more research, longitudinal prospective studies to know what will happen if we don't treat obstruction and let some this pharmacological treatment for so many time. And more questions about the sexual dysfunction and what means the erectile dysfunction and ejaculatory dysfunction. What's the point of view of the patients and how these new therapies put these problems out compared to the traditional treatments. I think that was a very interesting roundtable.
As you were in a session discussing about new surgeries or new techniques for BPH to relieve obstruction, did you discuss about the learning curve of these new techniques? Because it seems that each new technique should be taught to surgeons, and was it part of the discussion?
Yes, it was part of the discussion that certainly many of these new techniques are very easy to learn compared with traditional ones, or even with other, like, any anatomical endoscopic enucleation is challenging. But some of these new minimal invasive treatments are really easy to learn with a very short learning curve. So that means that many of the surgeons can be ready to perform the surgery in a reliable way. The point is that we need the longer follow-up to see if these results are really comparable to the traditional techniques or not. Maybe the time can tell something more in the future, but nowadays we still need more evidence.
As we discussed the sessions you were today, to get to both of you, what is your main reason for you to come to ICS?
ICS is one of the highlights of the year for me. It's the reunite with friendly, familiar faces with colleagues, but colleagues on all different disciplines. You have medical specialists, but also physiotherapists, urodynamicists, you have basic scientists, and it all comes together and we unite and we bring ideas forward, learn from each other, go back and forth, and that's so nice.
And Salvador, for sure, to come to Madrid is a big argument.
Yeah. All of you are very welcome to come here to Madrid, Spain. We're very happy to have all the ICS people here with us, and we're very proud of it. But for sure, we know ICS is a perfect place just to share knowledge, just to share experience, and to enhance friendship. It's not a bad point. I think that friendship makes the networking much better, and we can learn from each other and to continue making research in a multidisciplinary way, and especially with multi-institutional studies. It's a good step forward to use this kind of meetings, and these societies are so sensible to this very important part.
I guess we all agree that we exit this very bad period of COVID and
sure.
suppression of any meetings, and now we recover. We have a fantastic meeting. It seems to be very well attended, and I really thank ICS for this opportunity to discuss today's session. Thank you very much.
Thank you.